Welcome to EMS Incident Command, the channel that brings you EMS and leadership content in short videos. Recently, we've seen EMS professionals in the news, dealing with the legal ramifications for improperly caring for a patient in crisis. Some of the most dangerous calls EMS professionals respond to are the ones where the patient is agitated, combative, or violent. Whether you are a new or senior EMT or paramedic, you certainly have come across the difficult patient. But is it a difficult patient? Or is it a challenging situation? EMS frequently responds to emergencies where the patients are agitated, combative, or violent. These situations are often complicated by alcohol use, substance use, or mental health illness. These challenging scenarios require quick thinking and even quicker action. Even in these situations, a thorough assessment is necessary to rule out a medical or trauma underlying cause. Consider the diabetic patient who is irate and confused. You might think to yourself, smells like a drunk, talks like a drunk, walks like a drunk. Would you consider that patient difficult, or would you consider the situation challenging? You should quickly evaluate the situation, perform an appropriate patient assessment to identify and manage clinical conditions that may be contributing to a patient's agitated, combative, or violent state. Rule out any conditions causing this behavior, including hypoxia, hypoglycemia, alcohol or substance intoxication, stroke, seizure, traumatic brain injury, or excited delirium. Do the best assessment you can safely complete. Document what you did, what you found, and what you could not assess and why. Excited delirium is associated with continued patient agitation or struggling, with or without physical restraint, and can lead to hyperthermia, hyperkalemia, rhabdomyolysis, and cardiac arrest. These critical patients require constant reassessment and good documentation of such. These challenging situations put you, your patient, your team, bystanders, and your organization at risk. You must remain keenly aware of the situation as it evolves. Your safety is paramount. The goal is always to provide the highest level of care possible while de-escalating tense encounters and avoiding unsafe situations. Will we always be able to de-escalate a difficult situation? Of course not, but we always try. Here are some helpful tips for dealing with challenging situations. When faced with a difficult situation, your safety comes first. Ensure your surroundings are safe for you and your team. Maintain at least an arm's length distance. If the situation feels unsafe, wait for law enforcement to arrive before entering. Always have a clear and easy way out should you need to retreat. Call for backup as soon as you think you might need it. Don't wait until it's too late. Your uniform might be a cape in disguise, but professionalism is your true superpower. Approach the patient with a smile, an open posture, a calm demeanor, and a respectful and soft tone. Introduce yourself, your role, and tell them you are there to help them and want to hear them out. Sometimes, people just need to be heard. Give them your full attention. Let them express their concerns, fears, or frustrations. Listen, pause, and acknowledge their concerns by repeating back what they said in your own words. Ultimately, the patient wants a solution to their problem. Let them know you listened and understood their concern. This simple act can help diffuse tension and build rapport. Play dumb. When being threatened, do not fight back. Ask clarifying questions to change the attack to clarification. For example, help me understand what you are saying, or I don't understand what you are trying to say. Even though you understand exactly what they are saying, it redirects them. Keep redirecting them, it may diffuse the situation. If redirecting them does not work, try silence. The patient may calm down once they realize you won't engage. Put yourself in their shoes, even if those shoes are doing a bit of a dance. Show understanding for their emotions and situation. Let them know you're there to help, not judge. Keep your explanations simple and clear. Tell them what you're doing every step of the way. This helps reduce anxiety and gives them a sense of control. Make them a part of the solution. Give them choices whenever possible. Would you prefer to sit or lie down? This simple question changes their focus from argument to action and helps redirect the patient to a solution. Catch them being good. Acknowledge their cooperation and praise any positive behavior. This encourages more of the same. Remember, you're not alone in this adventure. Coordinate with your team. Assign roles. One person can focus on patient care while another maintains communication with the patient. Sometimes, even superheroes need backup. If the situation spirals out of control, don't hesitate to call for additional help or law enforcement. Your safety is the top priority. Find a way to connect with the patient. Distraction and humor can diffuse tension and shift the focus away from hostility. A bit of friendly small talk or a well-placed joke can work wonders. Whether they are combative, confused, or just plain mean, don't take it personally and don't react. It is easy to react when punched, kicked, or spat at, but you must maintain control of your emotions so that you can take control of the situation. Responding to anger with anger will only escalate an already difficult situation. Don't scream at a screaming patient to calm down, and don't threaten them if they don't. That never works and only gets you more upset. If you're too triggered, allow someone else to talk to the patient instead. If there is family at the scene, get their perspective, acknowledge their concerns, and ask them for their help to de-escalate the difficult situation. Involving them makes them feel part of the solution and will better understand it if you have to restrain the patient later. If de-escalation techniques fail and you have done an assessment and determined that the patient is a risk to themselves or others, then you should consider restraints. Restraints are only indicated to protect a patient, the public, and emergency responders from further injury, facilitate assessment, or allow for treatment of life-threatening injury or illness in a patient without decision-making capabilities. See our video on how to determine decision-making capacity at the link at the end of this video. When considering the use of restraints in pre-hospital care, EMS providers must be acutely aware of the potential adverse reactions, as well as the legal and ethical implications inherent in such interventions. Adverse reactions to restraints, whether physical or chemical, can range from physical injuries, such as fractures, to exacerbation of underlying medical conditions, asphyxiation, and cardiac arrest. Additionally, chemical restraints, such as sedative medications, can lead to allergic reactions, excessive sedation, depressed respiratory drive, or respiratory arrest followed by cardiac arrest. EMS providers should thoroughly assess the patient's medical history, allergies, and current medical condition to minimize the risk of adverse reactions and ensure that the benefits of using restraints outweigh the potential harm. The improper use of restraints could lead to legal liabilities to you, the EMS provider, and to your agency. If you do not have a medical justification, based upon your training and your protocols, to restrain a patient and there is a bad patient outcome, you could be prosecuted criminally. Physical restraints. Any physical restraint must be quick and easy to remove if the patient's condition deteriorates and life-sustaining interventions are indicated. Rigid restraints, such as handcuffs, should only be used by law enforcement, and a police officer must accompany the patient during treatment and transport. If a restraint that requires a key is used, the key should accompany the patient too. Pre-hospital restraint devices are different to those used at a hospital or by law enforcement. Follow your EMS region and department guidelines and protocols for guidance on devices approved for pre-hospital use. Patients must not be restrained in a position with hands or feet tied together behind their back, or restrained with techniques that compromise the airway or constrict the neck or chest. Patients must not be restrained in a prone position nor under backboards or mattresses. Chemical restraints. Pharmacological management of an aggressive, combative, or violent patient should only be used as a last resort after all other de-escalation techniques we've discussed have failed. Some EMS regions have standing protocols for this, others require you call online medical control for pre-authorization. Follow your region and department protocols. Medications used for sedation are usually a dissociative agent like ketamine, a benzodiazepine like midazolam, or a butyrylphenone like droperidol. These medications can cause respiratory depression, and every patient that receives one must be continuously monitored and treated promptly by EMS. Transport to definitive care is also required after administration of any of these medications. Continuous reassessment of the patient should be completed at regular intervals, as directed by your EMS region, and documented every time physical or chemical restraints are used. Continuously monitor the patient's vital signs, level of distress, and comfort. Maintain a watchful eye on respiratory and hemodynamic status as well as neurovascular status of all restrained extremities and document this in regular intervals. Documentation should include details of the patient's behavior that led to your interventions. Patient assessment. Do your best to obtain a full assessment, with full sets of vital signs, but if you are unable due to safety constraints, document what you could assess, what you could not and why you were unable to. At least document what you attempted to assess each time you did. These details can help explain your actions or defend you in the future. Lastly, remember that when dealing with a patient in crisis, you have to always assume you are on camera. What you do and say at the scene can be posted on social media or news outlets quicker than you can get back to your unit. Be aware that you are not only speaking to your patient, but also to everyone else present and to those reviewing that video footage in the future. You must remain professional and calmly explain what you are doing. Say things like, "Joe, we see you are experiencing a crisis right now and only want to help. Please stop attacking us so we can take care of you. We don't want to hurt you, Joe. We need to care for you. We are very concerned about you, and we are trying to be gentle with you, Joe, but you're making it very difficult. Please stop fighting us. We are only trying to assess you and get you the help you need. Please don't punch us. Joe, I need you to stop kicking. I don't want you to hurt anyone here. Please stay still so I can safely secure you to our stretcher. We are going to take you to see the doctor at the ER for your safety." Whatever you would want an untrained bystander, or a jury, to understand about why you did the things you did, are the things you should be telling your patient too. If there is a police officer at the scene with a body camera, you can ask them to make sure they record this event for additional documentation. Don't forget to add the police officer's details so that video can be found later if necessary. EMS providers should be well versed in the potential adverse reactions associated with restraints, exercise extreme caution to ensure legality, and approach the use of restraints with a strong ethical commitment to patient safety, dignity, and autonomy. Remember, de-escalation is the primary goal. Use physical restraints only after de-escalation failed and the patient is a danger to self and others. Sedation should be your last resort. Follow your EMS region and department protocols. Contact medical control for guidance and whenever you have questions about the correct dosage for your patient to avoid adverse reactions. As we deepen our understanding of managing challenging patient encounters, let's remember that every interaction is an opportunity for growth. By embracing the concept of patience in difficult situations and incorporating the strategies we discussed here, we're equipping ourselves with a comprehensive toolkit. Leadership Corner. As supervisors and mentors, we should be supportive to our coworkers during these high-stress, bad calls. If you can, show up at the scene and offer your support and guidance when they need it. Let them know you have their back. Assist as appropriate. If you can't make it to the scene in time, call that crew and ask them how that call went, how do they feel and if they are okay. Injuries are common during these type of incidents. Ask them if they want to talk about it with you or someone else. Have a list of mental health resources available just in case. Difficult calls can take an emotional toll. We are all human after all. This simple act of kindness can help boost morale and minimize provider burnout. Thank you for watching. Please like and subscribe. Don't forget to hit the notification bell to stay up to date on all future videos. We want to give you the content you want. Let us know in the comments if there is anything you would like us to discuss in future videos. Please be safe out there. Until next time.